As we all get older, our spine and joints and discs all start to degenerate. That means that they start to break down and form abnormal bone growths. This process can cause pain. In addition, the same process can cause compression of the spinal cord or the nerves that are coming out of the spinal cord and going into our arms or legs. Cervical spine disease can present with a variety of ways. It can be pain in the middle of the neck, pain shooting up into the back of the head, pain shooting down the arms, or it can also present as weakness, such as trouble gripping objects with your hands or problems while walking up and down stairs. As part of the treatment process, what we strive to do is 1, reconstruct and rebuild the normal anatomy of the spine, and then 2, take away the pressure that's pushing on these nerves or the spinal cord itself. We can approach the cervical spine one of 2 ways. It tends to be either from the front or from the back. When we go from the front, we have access to the disc space itself. So if it's the disc that's causing problems, we can get in and remove the disc. Once we've removed the disc, there's 2 things that we can tend to do. 1 is a fusion, where we place a graft and cause 2 bones to become 1 bone. This is a very successful surgery. Over time though, sometimes this can cause changes in the structure and mobility of the spine. And so more recently we developed techniques where we actually replace the disc to allow constant mobility at this level. That process is called a disc replacement. I tend to try and do disc replacements whenever possible over doing fusions. When the problem is compression of the spinal cord or nerves from the back of the spine, that's when we take an approach from the posterior aspect. The goal there is to remove the bone or overgrowth of ligament or tissue that is compressing the nerves or spinal cord. Once that bone has been removed, more often than not, it doesn't cause any problems. But sometimes we put rods and screws to create a scaffold to hold the spine up so it doesn't tip over due to the removal of bone.